Hello, welcome to 5 minutes on the Digestive Problems curriculum statement, just to get a flavour of the maps. There are some useful guidelines on iron deficiency anemia, but what I'd like to show you here is these excellent MERIC bulletins on dyspepsia. The first on the initial management of dyspepsia. I'm a fan of case studies, and Mr. Park is a 57-year-old sales manager complaining of intermittent heartburn and epigastric discomfort. It's a very comprehensive overview of how to deal with them initially, and this is the overview of the management on the whole. This is 8 pages. The initial management is a 4-page review. Sign also has some useful guidance on hepatitis C and dyspepsia, as well as some cancer guidelines. The intro is so short here, you can just hover on the notes icon, which gives you the full text. The UK health priorities are bigger, so I would recommend that you click on it and then just drag this across like that so you can read it. Moving on to the primary care management section, if we just have a quick look at investigations, I've put in a link here to this excellent site known as Lab Tests Online, a UK site where you can actually look at a whole variety of lab tests in varying degrees of detail. As an example, I've shown you the celiac antibody screening link, and I would say that the test is subdivided, but also look at a glance, test sample, common questions and links. This is a link into the NHS bowel screening program homepage, because one of the investigations are FOBs, which fell out of favour at one time but are now back in vogue. Zooming in on specific problem-solving skills, demonstrate a structured, logical approach to diagnosis of abdominal pain, including a positive diagnosis of irritable bowel. This link, which I can't demonstrate at the moment, does actually link to the Manning and Rome criteria, etc. The comprehensive approach, things like the GI side effects of common drugs and the modification of the form or modalities of treatment to cater for the patient's GI function preferences. Very useful to discuss with junior doctors or nurse practitioners, as there are often many options which aren't necessarily considered. Under community orientation, we're encouraged to describe the rationale for restricting referrals for upper GI endoscopy in the management of dyspepsia. Well, useful link there, or just not so much a link but a note entry. Any patient with dyspeptic symptoms who have not had an endoscopy are now classed as having uninvestigated dyspepsia, whether reflux symptoms dominate or not. And a little note here on the meaning of GORD, NUD, PUD and ER-ND. And this is a link to the MERIC bulletin that I've already shown you. In being holistic, we're reminded that psychological stress can affect bowel function in these various conditions, and also the impact of social and cultural diversity and health beliefs relating to diet, nutrition and gastrointestinal function is something that we're often battling against, and putting in some links here would be very useful. And I would encourage you to go to the generic website section at the top of the map, which has some great resources that you will be able to use to meet your learning needs, for example CKS, and just go to the gastrointestinal section and there's a wealth of resources on both the heavy duty topics and things which we might consider potentially more minor, such as halitosis or hiccups, though I'm sure you know hiccups can sometimes indicate renal failure. On the left side of the map, as always, don't forget context, attitude and science. And finally, to show you this little link into abdominal examination at oskiskills.com. So close the map by showing level 1, and then please feel free to click on the link below so you can start reading and playing with the map yourself. Thanks for listening.